It's not lockdown, but it feels like the country's staying at home. Businesses forced to shut without the staff to open. 1 million people now self-isolating as Omicron takes hold. Hospitals in Bristol and across the country in a critical situation and asking for extra help. The disruption runs to the railways, train departure boards empty, and a government trying to ease the pressure with new policies to try to keep the country moving. Changes to testing, lifting the burden for people travelling to the UK, scrapping PCRs for some who test positive on lateral flows.
Are you gambling with the NHS, Prime Minister?
Tough decisions to deal with logistical pressures around the UK. The PM back to Parliament, hoping to turn a corner, but the political pressure not letting up either.
In response to the latest data, the Cabinet agreed this morning that we should stick with Plan B for another 3 weeks, with a further review before the regulations expire on the 26th of January. This government does not believe we need to shut down our country again. Instead, we are taking a balanced approach, using the protection of the boosters and the Plan B measures to reduce the spread of the virus.
A balance that risks pushing the NHS over the edge in the most difficult of winter months. The opposition bench is unconvinced.
The Prime Minister has said we have to ride out this Omicron wave. But the NHS isn't surfing. It's struggling to stay afloat.
Prime Minister's central approach to ride out the Omicron wave is a reckless gamble that risks lives and risks the NHS.
But his own side, from a former PM to a former Chief Whip, not entirely satisfied either.
It is not in the national interest to partially or wholly shut down sectors of our economy every time we see a new variant.
We have got to have a plan to live with this virus like normal forever. When is he going to set that plan out in this House?
Constantly changing rules, leaving the public here in Birmingham frustrated and sceptical too.
You should probably have another lockdown by now, or at least be doing more than what they are to stop it spreading. It seems to me that he's not doing anything to stop it spreading.
If anyone watched the press conference yesterday, there was no clarity in that at all. There were lots of waffling answers, and yeah, it feels like a free-for-all.
His agenda is based on the Telegraph, based on his own party, not really public opinion.
And this is the dilemma Boris Johnson's now facing. In this place, his MPs don't want any further restrictions, but beyond Westminster, the public mood is restless, and there are genuine fears that hospitals could become overwhelmed with such high levels of cases. The Prime Minister then pulled in 2 different directions. Today, he tried to deal with it by changing the testing regime instead of introducing new restrictions, but he can't be sure it's enough. MPs remain desperate for an exit strategy, but with 1 in 10 Londoners with the virus in the last week alone, there's still no end in sight. Beth Rigby, Sky News, Westminster.